So let's go back and talk about different type of injection. What is the whole point for injection? The injection is about delivering the substance into the right place. Injection is about delivering chemistry to drive the biology. Let's put it simply, it's by putting the correct medicine, cells or substances into the right place for the right time. So what can we inject into the joint? We can use corticosteroids, which is relatively common, but I will tell you there's dangers to that. Local anesthetic for testing is the pain that coming to the joint, but again, there's another issue with that. Or tranexamic acid to stop bleeding, hyaluronic acid for lubrication. Some say hyaluronic acid is like WD-40, giving a little bit of grease into the joint. Other substance is a little bit thicker. There are thicker substances like hydrogel. So what is a hydrogel? A hydrogel is basically a gel that's made with water and some substance into it. Usually it's a synthetic molecule which made in a lab. The common type of hydrogel is polyacrylamide. One of the gel is called arthrosamid. I have good experience about this gel, but again, it is not benign. There are potential complications can happen with this gel. Next type of hydrogel is hydrogel scaffolding, which is basically using that laying the soil for the body. One of the very common injection that we have got is called ChondroFiller. It is a hydrogel that mixing water and collagen. This is a lot safer because it is absorbable in comparison to the other type of hydrogel. Once you get injected, it stays in the body forever. When there is a problem, it stays forever too. And also sometimes we can inject cells into the body, and by injecting cells into a damaged area, it allows the body to try to heal itself. So some people call it stem cells delivery. What is stem cells? In medicine, we think about stem cell is a cell that can grow into multiple things. But in orthopedics, what we call about stem cells is MSC. Actually, what we're calling that is medicinal signaling cells. What it does is actually trying to direct the cells nearby to regenerate. The cells do not turn into new cartilage, new ligament, or new joint. It is very different from the cells that we use in orthopedics and sport medicine in comparison to the stem cells that we talk about in the lab. So this is very important to understand the language. Injection, we can put in cells, we can put in chemical such as steroid or local anesthetic, and we can put in other substances such as hydrogels. The dangers about using steroid. Steroid is a drug. Typically, people call it depomedrone, Kenalog, or cortisone. These are quite dangerous. These chemicals, once it get into your cartilage, it changes the shape of the cells. It is toxic to the cartilage. The pH, which is the acidity with this drug, is very different to what the joint environment is. So this is why quite often when people have the injection, it's quite painful. And as doctors, to reduce that pain, we often mix it with local anesthetic. So therefore we numb the joint before that was injected. But you can see by injecting something that is hurting you, it does have damage. By causing the damage, sometimes it's necessary to reduce the inflammation. It does work very well, but certainly if we think about regeneration, it is not something that we want to use in the first line. So what should we do when someone's saying that we should have a steroid injection? Of course, there's horses for courses. Steroid injection is very important and very powerful. I do steroid injection for my patients too, but again, we need to do it for the right reason. If there is a end stage osteoarthritis that we're about to operate on in a year or two, then yeah, sure, put some steroid into it to calm the pain down, because at the end of the day, the joint's going to be replaced anyway. However, for younger patients, if they want to preserve the cartilage, I wouldn't recommend just to have steroid alone. There's good ways that we can neutralize the effect of the steroid, but also reap its benefit. Often, I mix steroid alongside with platelet-rich plasma. By doing so, it neutralizes the acidity. Or sometimes I mix it with hyaluronic acid, which is basically hyaluronan. It's a substance that's lubricating the joint. By mixing that with the steroid, it maintains its effect, but at the same time, it is slightly less toxic to the cells. So overall, steroid injection is not an absolute no-no. We just need to do things for the right reason. It's about understanding the condition before we are thinking about fixing it. Again, without fixing the physics, chemistry and biology will not work. So don't think having an injection is magical, it will just work. Without changing the physics, without understand how to change how a body moving, is never going to be successful. Without correcting the way that you move, any injection alone will never be successful long term. Polyacrylamide injection, what is it? Furosemide, what is it? Why should somebody have this injection? Polyacrylamide is a hydrogel. It's a long chain chemical mixed with water. Actually, 95% of it is water. It acts as an implant to go inside the joint to form a shield to reduce the inflammation. And that's all it does. There's no regenerative property. It is not something that will regrow your cartilage. And yet, it is not even something that will cushion between your cartilage. What it really does is slowing down the inflammation around the synovium, which is the lining of the joint. It cushions the joint on the outer aspect instead of the inner aspect. But the downside of a furosemide is that you may get an infection because it is act as an implant. If it gets infected, it stays infected with you forever. So my advice, if you consider having a furosemide injection, you need to understand what you're about to have done. Make sure that you have antibiotics. My preferred antibiotics is intravenous antibiotics. Therefore, it's got 100% bioavailability. Although some people will suggest taking oral antibiotics, but in my opinion, I don't think that's a good idea. I want it to deliver into the right place at the right time using an ultrasound guidance injection. By doing that, we can ensure safety and reduce the chance of complications. Does a furosemide always work? Absolutely not. It doesn't work on everybody. But at the same time, it is the last defense that we have if we want to avoid a knee replacement. But remember, this is not a regenerative injection. This is something to slow down degeneration. That is all. Regenerative injection, what is it? How can we regenerate a joint with injection? So regeneration is about physics, chemistry, biology, and the timing. You need to understand what's happening in the joint. You can't just do it blindly. Without correcting your movement, the effect of regeneration will not last. It is something that's fundamentally important.